How can I progress my anatomy knowledge? How can I take the first step on the road to mastery?
Well, most people will start with textbooks, and I do recommend. Obviously, that's a great place to start. You're going to pick up different things from different textbooks. They're all two-dimensional, and that's probably the first thing. Is that most people think that knowing the two-dimensional, being able to label all the arteries is a good step, but you rapidly feel like as soon as you're confronted with the real face, you realize this is different. It's three-dimensional. It's an individual person with the slightly variations in anatomy. And that sense of clarity that you get when you can finally label all the arteries, which is a good place to start, disappears when you're actually confronted with a patient, because I think inherently most people realize it's a bit more complex than this. Like, you've learned the academic anatomy, but you haven't learned clinical anatomy. You have to take it to the next level and make it real for this particular patient. And that involves basically an extra step, which is what I recommend you do after you've done your textbook reading. Textbook reading is great, but you need to do more.
But people often ask, which are the good textbooks? And I think it's fair to say this industry isn't sort of swimming in amazing, accessible textbooks. Is that right? Would you say?
It's certainly got better.
Right.
There's certainly more than there were when I started out.
Could we link below, maybe afterwards, some links to some good? Yeah.
Probably the one I find, it's cadaver based as well. So called facial topography. Facial topography, I think it's just it. I'll link below. But that's one of the most beautiful textbooks I've got. There's loads of great pictures.
Do you remember how much it was out of interest? Because
it was expensive, so a few hundred quid.
Because that's the thing.
Maybe even 300 quid or something. It was the most expensive book I've ever bought.
Yeah. See, that's the thing, isn't it? It's like that we're probably going to go through now like a ladder of the different and increasingly better ways to skill yourself up. But if I'm making a decision, if you're saying, well, the first rung in the ladder is a textbook and they're not the shizzle, then that's going to make me think, well, should I even bother? Or, I don't know whether you have any thoughts on that.
I definitely think you should bother. It doesn't have to be the 300 quid version, but you need to have some reference that you're starting to integrate this knowledge into your practice.
But maybe the reason I'm saying that is because I know that I don't mean this to be a plug, but at Skin Baby Training, we have amazing manuals for people who come and train with us. So maybe is it enough to have, for example, our manuals? But I suppose a lot of people who are watching this won't have come to us.
Well, it's certainly helpful to having a manual, but the next stage on the process, we're going to say, is actually it's how you utilize that information in day-to-day practice. And that comes from your first training course. You should be on those days realizing how anatomical knowledge affects your decision making.
Right. And
that's the most vital component of it. What happens as you get better is your resolution for those decisions goes up. So
what do you mean?
So it's the resolution of your anatomy, for example. Like if you look at a diagram of a face, you can tell, for example, that your superior labial artery runs above your lip. That's a bit different to getting the sense that a millimeter or two is going to make the difference between being in it and near it. Yeah. And you start to get that sense. Like, I'm pretty confident at one position in the vermilion border that there's no chance I'm going to be in an artery.
Because you've dealt with real human beings, you mean?
Yeah, it comes from all the factors. I mean, it helps massively seeing it in a real, that's, the ultimate, the gold standard is cadaver, studying a cadaver, which we're lucky enough to be able to do and to offer. But it's actually formed by multiple things. Like, some of it can be a soundbite that goes in on a particular training session. I remember, I still use this analogy myself, the Loch Ness Monster. So the artery moves like the Loch Ness Monster bouncing along the vermilion border. That goes into my head as a snippet that I use to navigate. So it's that kind of thing. You might get a snippet from one person talking about anatomy. You might get an insight from a photograph in a book. You might go in a cadaver class and actually see it. And all of these things, they start to build your mental model.
Yeah.
So it's a little bit like, if I go back to the analogy of knowing the way, if someone showed you a map of Manchester, how to get in a black and white map, it would help, but a colour map might be slightly better. An aerial photograph is the next step up, and then actually walking there would give you a totally different experience.